Good afternoon, folks. This afternoon's topic C. It's about protecting elderly from extreme heat. So here we go with today's discussion. C for you. Okay, here we go. Extreme heat is now one of the deadliest weather hazards in the United States, and adults age 65 face disproportionately high morbidity and mortality, psychological or physiological aging, chronic disease burden, medication effects, and social isolation combine combine to make older adults uniquely vulnerable. Evidence from heat.gov, heat.gov, the CDC, and the recent research demonstrates that targeted policy interventions can significantly reduce preventable illness and death. Scope of the problem: older adults are the highest risk population during heat waves. People age 65 plus have reduced ability to regulate body temperature, diminished sweating, and slower physiological responses to heat. Chronic conditions such as cardiovascular, pulmonary, and kidney disease exacerbate heat stress. Many common medications: diuretics, beta blockers, anticoagulants, psychotropics, impair uh, thermoregulation, social isolation, and limited community engagement increase risk because older adults may not take self protective actions or have anyone checking on them. Heat waves are intensifying. A rapid review of global studies from 2010 to 2024 shows increasing frequency, duration, and intensity of extreme heat events, with older adults consistently experiencing the highest rates of heat related illness and death. Key drivers of vulnerability: physiological and medical factors. Reduced sweating and blunted thirst response, chronic chronic disease burden that limits cardiovascular and respiratory compensation, medication interactions that reduce cooling capacity, environmental and social economic factors. Older adults may lack or avoid using air conditioners or conditioning due to cost. Power outages during heat waves disproportionately affect those dependent on oxygen concentrators, refrigerated medications, or other life sustaining devices. Urban heat islands increase exposures. Rural areas face transportation and service access barriers, service and system gaps. Few studies examine heat related policy implementation, and many communities lack coordinated heat response plans tailored to older adults. Policy recommendations strengthen heat response infrastructure, mandate local heat action plans that include older adults, specific, specific, specific protocols, hydration checks, air conditioning, access, transportation. Expand cooling centers, networks with transportation support for mobility limited adults. Require back require backup power systems in senior housing, assisted living, and home-based medical equipment programs. Use HHS's Empower map to identify electricity dependent Medicare beneficiaries for targeted outreach, improve access to cooling and energy assistance, increase funding and automatic eligibility pathways for LIHEAP cooling assistance for low income older adults, incentivize installation of high efficiency heat pumps in older adult housing, enhance clinical and community preparedness, require heat, require health systems and home care agencies to implement heat day protocols, including hydration plans, medication reviews, and twice daily check ins. Integrate heat risk screening into Medicare annual wellness visits. Train caregivers using CDC's heat stress checklists. Hydration, AC access, symptom monitoring. Strengthen public health communication. Fund multilingual, accessible heat risk campaigns tailored to older adults and caregivers. Promote, promote use of the CDC heat risk dashboard for real time risk assessment. Partner with senior centers, faith communities, and Meals on Wheels for rapid information. Discrimination. Support research and data systems, expand federal funding for research on heat-related morbidity in older adults, especially in rural and low-income communities, require standardized reporting of heat-related hospitalizations and deaths by age, geography, and housing type. Encourage participatory planning with older adults to improve risk communication and intervention design. Expected impact of policy action. Implementing these measures will reduce emergency department visits and hospitalizations for heat-related illness, prevent avoidable deaths among high-risk older adults, strengthen community resilience during climate-driven extreme heat events, reduce strain on EMS, hospitals, and long-term care facilities during heat waves. Extreme heat is a predictable, escalating threat, and older adults of them are its most predictable victims. The science is clear. Heat-related illness and death are preventable with coordinated policy, targeted outreach, and infrastructure investment. Federal, state, and local leaders have an urgent opportunity to protect aging Americans by treating heat preparedness as essential public health infrastructure. Okay, guys, that's your tea for tonight. I'll be back on to do one more show in a bit. For now, Gator Wellness. Take care, folks.